Welcome back to another episode of Bugs, Drugs, and Genomes. This is Ella.
Zephy.
And we're so glad to be back for another episode of the podcast as we dive into another fascinating aspect of AMR, global health, and capacity strengthening. Today, we're joined by Lona, one of our project managers, and she's going to talk to us a little bit about a project that she works on called EQAsia.
So hi, Lona. Welcome to the podcast.
Hi, Sophie. Thank you for letting me be here.
So far, we've had several scientific staff from the group discuss AMR surveillance, outbreak detection, and things like that. So today, we're more focused on discussing EQAsia, which is the project that you and I are on. So do you want to maybe share some thoughts on EQAsia and also about yourself as a project manager in the group?
Absolutely, sure. First and foremost, I'm Lorna. I come with a background in global health, humanitarian sector, and development sector. So the project EQAsia that we're working on is a Fleming Fund UK-funded project. Basically, this entire fund is set out to do initiatives to combat AMR globally, focusing primarily on Africa and South and Southeast Asia. I have the privilege of running the regional grant EQAsia, which basically focus on establishing trials for laboratories to test their ability to detect resistance in the bacteria that we have globally set out to surveil. So that's basically what we do in a very simple version. It's much more technical than that, but yeah, in short, that's what we do.
So could I maybe ask, because of how extensive this project is, you mentioned that you work with countries in Africa and Asia. What is the objective behind working with these countries, and what are we trying to sort of achieve through this project for someone who doesn't know what EQAsia is?
Mm-hmm. So first and foremost, EQAsia, we only focus on the Asian regions. We cover 14 countries in the project EQAsia in South and Southeast Asia, and we cover approximately 80 labs across those 14 countries. The goal of our project is basically to make sure that whatever surveillance data we get in on a national level and international level is reliable. Mm-hmm. So our project is set out to, together with the labs, to actually do these trial runs of certain bacteria. So we send out bacteria for the labs for them to test. They report back to us on what their results are, and we give them feedback on it. And we troubleshoot as well. So basically, when we get the results, we try and look into if there is a mistake in their data, in their
protocol,
identity, everything. Where is the problem, and how can we go in and help them become better at it?
Exactly.
So the objective here is to literally make sure that we can trust whatever data we get in. And this is also, it's not just for surveillance, it's for the purpose of patients, to make sure that anyone who goes to hospital gets the right treatment, gets the right antibiotic. Our work becomes important because the data that we see these labs reporting and acting upon, if it's not the correct, if the answer is incorrect, basically it can do a lot of harm. So we try and be preventive of that.
So when you say we troubleshoot their issues and we help them sort of improve on all of these fronts, I know that we do some sort of trainings, webinars, trials. So can you maybe elaborate on that for our listeners as well?
Yeah, so first I would say it's not just a GloCab effort. EQAsia is a impressive consortium of 3 partners right now, although we used to have more partners in it. But basically, DTU have teamed up with Chulalongkorn University in Thailand, who's one of the leading faculties in terms of veterinary.
And very nice people.
And very nice people, awesome people that have both the brains, the skills, and the heart to really fight it for their sector specifically, the animal health sector. And then we work with the International Vaccine Institute in South Korea. It's often referenced as IVI. Basically, there's not this one-size-fits-all acknowledgement in the project, which means that we internally in EQAsia have challenged ourselves quite a lot in terms of what is the right way to teach people. And with the acknowledgement that we may think one method works for one lab, but another lab may need something different. We wanted to create a variety of capacity building opportunities that wasn't mandatory for them, but that could be a little bit of a pick and choose one-stop shop for them, that they could choose according to where were they at the labs, what was the specific need that they were having, or the dream that they wanted to develop within the labs, but also with a respect that a lot of these labs are already understaffed and are not only working on trying to combat AMR, they're also serving hospitals
of course,
as a daily management.
I was going to get to this, but I think you sort of touched up on this. But what are some limitations that you see in the project, as in terms of moving forward and how we can sort of resolve these limitations?
You can design the most beautiful project on paper, and the moment you start implementing it, it just doesn't fit. Like this shoe doesn't fit.
Yes.
And oftentimes it's because you can't predict the circumstances that you're in. The labs are very different. Sector-wise, you see a huge discrepancy as well. And it makes sense. It's not a critique of the countries. It's, again, a huge acknowledgement of them having to do some really tough priorities on a daily basis in terms of policy making and where to put their money.
Of course.
So oftentimes human health sector is more prioritized than any other sector, despite the fact that the other sectors are so crucial for human
health sector, yeah.
So I think that whole acknowledgement of local conditions is really important. I think we can become better at it. Our issue in EQAsia, to reflect on that, has definitely been that we are not country-based in each country. If we had been in every country, we would have been so much easier.
Yeah, we can interact and communicate so much faster, get the results in, get the results out. Yeah, I agree.
You've tried this stuff.
Yes.
Like, you can write the most beautiful email and you just get silence as a treat back.
As a response.
Exactly. And it just so takes longer, these things. But at the same time, I don't necessarily saying that it was wrong for us to sit with the project, because we have the knowledge and the capacity. And I think we are really good at building those strong structures to drive a project forward. But there is, if we could do a third round, I would add a local aspect to kind of also make sure that
we are in the
process,
region kind of physically or like just there.
Yeah, and to push the day-to-day process forward.
Taking into all of these aspects that we just discussed, I think it goes on to show how important it is to do capacity building and AMR surveillance in a project as extensive and as vast as EQAsia. That kind of wraps up our session on having a project manager talk about what we do in the GloCab group. So thank you so much for coming in, Lone. And I think it was really nice to discuss about EQAsia for a change.
Thank you for giving me this chance.
We're just about ready to wrap up the episode, but before we go, Zephy has a quick quiz for our listeners.
All right. So the question is, what is one major benefit of sharing AMR data internationally? And the options are option A, early warning of new resistance mechanisms. Option B, reduced transparency between countries. Option C, delayed response to the global outbreaks. And the answer is option A, early warning of new resistance mechanisms.
Thank you so much for tuning in to another episode
of Bugs, Drugs, and Genomes.
We'll see you next time.